I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I want to give you our weekly update on the COVID-19 pandemic and the situation at GBMC. So as I speak, we have 15 patients in the hospital who have tested positive for COVID-19, and we have another 9 patients who we are awaiting test results for. So you can see that there has been a significant flattening of the number of cases. This appears to be the experience as well across the entire state. You will recall, and it has continued to this day, that Prince George's County and the Capital Region have more cases than most of the rest of the state. But we are nowhere near capacity. The state is using 1/3 of the available ventilators, and we have plenty of beds to serve those in need. A new issue has come to the forefront this week. There was a paper in the New England Journal of Medicine describing the situation with people with chronic disease and acute medical problems being fearful of going to the hospital, thereby getting themselves into significant trouble. I want to reassure everyone that you are safe at GBMC. We are sequestering COVID-19 positive patients and those under investigation to one specific unit, as long as they don't need the intensive care unit. Patients coming with other diseases are kept on different units as long as they do not have a suspicion of COVID-19. Again, I want to thank all of you for heeding the governor's rules about social distancing and washing your hands. Some data that came out earlier this week from 2 different studies in California suggests that roughly 5% of people in those areas have been exposed to COVID-19. If we were to take those estimates and translate it here to Maryland, we would find that roughly 10 times as many people as have currently tested positive for COVID-19 have actually been exposed to the virus. This makes perfect sense since we know that roughly 80% of patients with COVID-19 either have no symptoms or have mild symptoms not requiring the hospital. If this were to be the case, then roughly 5% of Marylanders would be exposed, but still 95% of our citizens would not have been exposed. I'm telling you this because we have to be very, very careful in lifting social distancing rules because the majority of our citizens are still susceptible to the virus. We believe that the governor will come out with guidelines for relaxing social distancing, but we must all be very, very cautious. And again, please wash your hands. So I want to thank you. I want to thank our SAFE nurses, our sexual assault forensic examination and domestic violence nurses in particular this week. We know that at times of crisis, oppressed people are more likely to be threatened and harmed by their oppressors. And we want to make sure that those individuals know that our team is available 24 hours a day, 7 days a week to help them if they need it. Again, let me end the way I always end. GBMC is here for you if you need us. Please be safe, and again, wash your hands.